Psych elective. I hope you all kind of had a good time trying out the activity last week with the meditation or restricting your daily phone usage. I was looking over your reports on kind of how it all went, and there was kind of mixed reviews of things that people tried and kind of how it affected them. So overall, it looked like either meditating for a bit each day or restricting phone usage was helpful and beneficial and had a positive impact. But for some, it didn't. And in fact, it could have been more negative or more stress and anxiety provoking, which makes a lot of sense at this time. For instance, restricting phone usage during the social isolation, it's further kind of cutting yourself off from, other people. If your phone, you're using it for social media, and that's kind of our one way that we're kind of staying connected to people. So I could definitely see that. I am definitely guilty of spending way too much time on my phone, and I try to be conscientious of not being on my phone when I'm around my family, but sometimes I fail pretty bad at that. Meditation, I've tried that in the past, and I've tried yoga and stuff, and I'm horrible at it. I have a really hard time clearing my mind. And so I think some of you can relate with this, that when I try to meditate, I start thinking about all the things I have to do. And then it just gets me more stressful and stressed out, and it doesn't go well. So I find other things that I do. So one of my favorite things to do to help me kind of relieve stress and anxiety is I horseback ride. So I own 2 horses. And one of them is my daughter's, and the other one is mine, and her name is Raven. And I horseback ride with her probably at least 4 days a week. And that's just a really nice release. It's really nice to get to the barn and ride and jump and all of that. And so that's kind of how I try to relax and relieve stress. So many of you probably have other things that work for you, but I hope this exercise was good to kind of give you an idea of simple ways we can try to manage our stress. Okay, you also had another activity that had to do with diet and physical health related to mental health. And so hopefully from doing that activity, you can see that there is a very strong connection between physical health and diet, as well as mental health and mental well-being. This week, we're going to kind of tackle a big kind of difficult mental health condition, post-traumatic stress disorder. So this is the area of research that I work in. So I work with patients that have post-traumatic stress disorder following exposure to a traumatic event, and it's debilitating and impairing in their daily functioning. And so one of my main interests is learning, why is it that 2 people could experience a similar traumatic event, but only one person develops PTSD and the other doesn't. You'll learn this week through going through the materials that treatments for PTSD, while effective, aren't necessarily as effective as they might be as treatments are for other mental health conditions. So, for instance, pharmacotherapy has pretty poor efficacy for the treatment of PTSD. Behavioral therapies are more promising and more efficacious, but they're also very difficult to do, and there's a high dropout rate. And even though some people respond to treatment, they still meet clinical diagnosis even at the end of treatment. Okay, so it does significantly reduce symptoms, but they still haven't reached a subclinical threshold. So a lot of my research is focused on how do we get people sub-threshold, and what are some other approaches. So what I have for you this week for PTSD is I've got a video for you that just briefly kind of introduces some people that have PTSD and how they kind of first knew that they had it. Then I've got this kind of brief, it's a real short, nice overview video prescribing for PTSD, know your options. It kind of summarizes all of the options really briefly into a nice, cool little animation. Then I have 2 videos, part 1 and part 2, of medication recommendations for PTSD, and this is from the National PTSD Center. And so this is a big organization that is a really great resource for both providers, patients, families for information on PTSD, what it is, how it occurs, how it's treated, prevalence rates, so forth. Well, they've got a really nice comprehensive video series on medication recommendations. So the first video is on monotherapy. The second one is on augmentation approaches for medication and PTSD. The videos are a bit longer, and it's not as exciting as the animated video, but it is by far probably one of the best presentations and more thorough presentations. Plus the speaker is really good at kind of explaining why and actually will show you some evidence for how we know these drugs work and what kinds of effects they have. So they mix some research into it as well. So, watch those as well. I also put up the PTSD treatment guidelines. It's a link to the guidelines. It's not required reading. It's just there as a resource for you. And then finally for PTSD, there's a discussion board, and it's called In the Evil Hours, an NPR podcast. So this is a really good podcast of a gentleman, David Morris, who served in the military, but he didn't see any combat. And then he was a reporter and was deployed and over there during the conflict reporting, and experienced a series of traumatic events and had developed PTSD from his experience as a reporter. So you're going to listen to his podcast. It's about half an hour long. And then you'll have a question there that you'll need to respond to. And so one of the things, and this is something really common that we see, is self-medication with drugs and alcohol. So David Morris states that he personally found that alcohol in moderation was one of the best PTSD drugs ever invented, and that he has been told by other survivors that the same thing. So what do you think about that statement? Is this a slippery slope? If you were speaking with him, how would you reply? And it's not uncommon to think that you might run into this with people that might be dealing with anxiety, depression, PTSD, OCD, social anxiety, things like that, they are self-medicating. And even if in moderation, is this approach appropriate? And how would you discuss this with a patient? Then you'll want to make sure you respond to 2 classmates' posts as well, just like we've always been doing. Keep doing what you've been doing at the discussion boards. Those are spot on, really good responses, very thoughtful. Then the next the next part of this week's information is going to be the live session this Friday at 12:30 in Microsoft Teams. I had sent an invite for everyone, so please let me know if you can't find that invite in your email. Check your junk mail, and I can resend it. I kind of was trying to resend it last night. A couple students said they couldn't find it. This will be with Patty Dixon. She's a licensed social worker at Wayne State, and she's part of CAPS, and she's actually our CAPS counselor in the Applebaum building. So she's there, and she is dedicated to our students in our college. And she's a really great person. So if you haven't ever met her before, she's super nice, and I think her presentation is very informative. So not only does it kind of, help with if you're experiencing anything, but her presentation also helps you identify when somebody else, like a classmate or anybody, might be experiencing some mental health crises, like what to look for and how to maybe approach it and what options are. So she's going to do a live session with us, and this is one of our 2 live sessions. I know it's tough to make it at a certain time online during this time, but this is required. And you will have a discussion board based on reflecting on her presentation. So you definitely don't want to miss it because you won't be able to do your discussion board. Okay? If you have any questions, again, feel free to email me. I will be grading your assignments today from last week. And I look forward to seeing your thoughts about the podcast, as well as I look forward to seeing you guys all actually in person on Friday. All right? You guys have a good day. Enjoy the weather, and we'll see you soon.